So good morning, everybody. Thank you. This is great to see such a wonderful crowd here at Old Dominion University. I hope you didn't have any traffic problems. Obviously, as you know, it's summer school for us, so hopefully Hampton Boulevard and the parking lot and the general environment was a little less crowded than normal when we have summer hours. My name is Nancy Grden, and I am the Executive Director here at Old Dominion University for our Strome Entrepreneurial Center. We are part of an Institute for Innovation and Entrepreneurship. And among the many things we do, we obviously work with entrepreneurs, students, faculty, and the community. But the really exciting thing we do, and the piece that we really believe, is that innovation can solve problems. Innovation, innovative thinking, new ways of doing things can solve very, very difficult problems in the community. So it's my pleasure actually to be one of the partners here at Old Dominion with the College of Health Sciences and many of our other disciplines who are here today to pull all of you together to look at this very interesting and complex, but certainly promising topic of healthcare literacy. So a little bit about what we'll do. First of all, it's an amazing group of people we have here. We represent businesses, we have advocates, we have providers in the community, interested party, and of course each one of us is a healthcare party in the sense of our personal lives and our families and what we deal with. And so healthcare literacy is a very real thing for each and every one of us. We have different views of what it is, what it can mean. But what is often overlooked is the fact that it has a huge impact on the economic prosperity of a region as well. And it has a lot to do with job creation, with social well-being, with mobility, and how we perceive ourselves as a community and as a region. And so a lot of what we want to talk about today are how these personal considerations of healthcare, particularly in underserved and new communities, how it can actually impact regions and their prosperity, and what we here today can do to advance that in Hampton Roads. So we're really happy that you're all here. A couple things on the program before we get started. First of all, we have an agenda. We are going to roll through the program. We have a lot to cover. And so if you do need a break, by all means, the restrooms are out in the hall. We have coffee, water, and so on. But we are going to continue to roll through. We'll certainly have some networking time at the end if that works for everybody. The other thing, we are soon going to pass out a cool little card. It says Healthier Hampton Roads. And we encourage every single person to, as you're here today, think about the role that you personally or your organization would like to play in what we're doing. So again, please fill this out. In fact, we won't let you out of the door unless you fill something out. But we really appreciate your feedback as well as the networking that goes on today. So what I would like to do at this point is introduce an amazing person here at Old Dominion University. It's our Provost, who is no stranger at all to healthcare in terms of his profession and his background. So I'd like to welcome first Dr. Augustine Austin Agho. He became ODU's Provost and Vice President for Academic Affairs in June of 2016, so a mere 2 years ago, 3 years ago actually, hard to believe. The Provost is the Chief Academic Officer at ODU and has responsibility for all undergraduate and graduate education programs, faculty recruitment and retention, as well as accreditation. Before becoming Provost at ODU, Dr. Agho served as Dean of the School of Health and Rehabilitation Sciences at Indiana University, Purdue University at Indianapolis, and as the founding Dean of the School of Health Professions and Studies at the University of Michigan, Flint. He also served as a faculty member and director of the Healthcare Management Program at Florida A&M University and the University of Illinois, Springfield. Provost Agho led the efforts to create the Urban Health and Wellness Center, a nursing and physical therapy clinic at the University of Michigan, Flint, and supported the student-run interprofessional health clinic at Indiana University. Provost Agho serves as a member of the American Council on Education Commission on Internationalization and Global Engagement, and as a board member of the Virginia, North Carolina, Lewis Stokes Alliance for Minority Participation. I can say on a personal note, he's a huge, huge supporter of innovation and entrepreneurship, as well as healthcare improvement here at ODU, and I certainly welcome Provost Agho.
Well, thank you very much, Nancy. I always like to hear my introduction because I don't think my wife gets to hear about me, how much I've accomplished. So whenever I hear it, I just wish you would come to meetings so you can hear about my accomplishments. I do want to thank all of you for taking the time to be with us this morning. It's not easy to get people of your caliber to give up entire morning from 8 o'clock to noon. In fact, as I look at your schedule, there is no space for bathroom breaks or anything. So I just want to commend you for willing to be here. Again, as a university, we're very pleased to host the Hampton Roads Health, Literacy, and Community and Leadership Forum. President Broderick, I would have liked to be here himself to personally welcome you, but he had to travel out of town. That's why he's not here to welcome you. I would like to take a few minutes, though, to really thank those who made this forum possible. As you will imagine, even though it's going to be just a half-day session, we've spent countless number of hours just planning to make this happen here. I think I just would like to single them out for special thanks. First, of course, you've met Nancy Grden. The second person I would like to acknowledge is Dr. Tom the Chamberlain for his perseverance. Tom, for those of you who know him, is somebody who doesn't take no for an answer. He will keep coming back, so we just want to thank you again for your perseverance for making this possible. I also would like to thank Dr. Bonnie Van Lunen, who is the Dean of the College of Health Sciences, for making this possible. I also would just like to take a minute to express my special thanks to all of you who have agreed to speak and be on the panel. I can't even imagine just looking at the slate of speakers. Governor Tommy Thompson is somebody I have followed for many years. I've seen him on TV countless number of times, but never had a chance to meet him in person. So I just want to thank you for the work you have done on behalf of our nation. I also serve here the Dr. Scott. Massey is somebody who's extremely busy, Jim Spurs, somebody that we all know very well in our community. He's a very busy man. The fact that he's going to give up 4 hours of his time this morning here, speaks volume in terms of the importance of this forum here. I also have Dr. Dimi, Barot, Lice Hall, and Angela Reddick. I haven't seen Angela Reddick. Are you here? Just kind of wave your hand. I know she's a champion of mental health in our community. I was able to attend a conference she sponsored last year, actually. Health literacy happens to be one of my areas of teaching and research interest. And I do so for 3 reasons. What we spend right now on healthcare in our country is not sustainable. If you look at the investment, what we spend and what we get in return, especially when you compare some of the health outcomes with other advanced countries in the world, what we spend is not a good return. Look at the outcome in Japan, even South Korea, with the UK. We spend far more on healthcare than most countries, but what we get in return is not what we should have. The other reason why I have focused my research interest on health literacy, because of the ethnic and racial disparities in health outcomes, life expectancy, and infant mortality. The third reason is that there's plenty of evidence in the literature that individuals with the ability to read, understand, and use health information are more likely to use a preventive health care and actually are able to even manage their chronic disease. And Old Dominion University has a long history of conducting research in health services and wellness. We hope that you will continue to see Old Dominion University as a partner and as a resource as we seek to improve health literacy in our communities. Again, our best wishes to you and welcome to Old Dominion University. Thank you.
So I would now like to introduce the person who does not take no for an answer. Dr. Tom Chamberlain. Maybe just a couple things. For those of you who don't know him, he has been literally a serial entrepreneur, has started and running an amazing company right now called EdLogics. And I myself also have some healthcare background, and I can tell you that the whole idea of bringing technology and innovation to healthcare is not a simple thing and not an easy path. And EdLogics has been able really to do it and has been able to use some new techniques that are frankly used in other industries. We accept them in other industries, but we haven't seen them replicated and embedded in healthcare. And so it's really a tribute to what EdLogics does, and also to Tom and his company for what they do as a leadership role in that regard. So without further ado, I'd like to introduce Tom Chamberlain to the group, Dr. Tom Chamberlain, who will take us through the next sections of the program.
Great. Thank you. Thank you very much, Nancy, and thank you to Old Dominion University for making this program possible. We appreciate, we'll start with thanking the people in the audience. You guys are busy people, very influential. You're going to be key to the success of a Healthier Hampton Roads, and I want to, on behalf of Old Dominion University and all the other individuals that were responsible behind the scenes, thank you for being here this morning and hopefully for your future involvement as we move forward. We're excited about what's going on in health literacy is a major area that we're going to be talking about in more detail, but I, as a clinician, as a PharmD, and we have a lot of clinicians here that representing physicians and pharmacy and nursing and others, we know that health literacy has been a major problem. That really is at the crux of it all. The non-adherence that we have to treatment plans, to medications, is really a function of low health literacy. And it doesn't discriminate against the low-income social determinants of health. It's the wealthy people, it's everyone in the entire spectrum in the community that has issues with health literacy. And that's really why we started EdLogics. I think it's the missing piece of the puzzle. And this talks about health literacy in the workplace. When we started EdLogics 6 years ago, it was our vision. It's the last chapter of my career. I was retired and came out of retirement with my daughter Brooke, who's here. And we started EdLogics. The hardest thing is, what is the name of this thing? But Education Logics is what we came up with, EdLogics. And it's not just in the workplace. We had as a vision, we bought the URLs of rewards for healthy living, rewards for healthy kids, rewards for healthy seniors, rewards for healthy families, Healthier Hampton Roads, and a number of other URLs, with the hope that we would get from the workplace to the universities, where we just launched a pilot at Old Dominion University, our first university using our platform on our mobile devices, the students at Miami University, funded by Aetna. And so we work with insurance companies, we work with healthcare organizations, but really improving health literacy of an individual is going to result in smarter decision-making, better interactions with their providers, and making them healthier, and we're going to reduce our healthcare claims. Those large employers that are focused on this, I keep cutting out. I'm not sure what's going on with my mic here, but Julio, you got me covered here, right? I'll keep going, and hopefully I'll and it kind of cuts in and out. But anyway, what we hope to do is reduce healthcare costs and improve health outcomes. I'd like to start with just a definition. We talked about health literacy. When we started the company, I couldn't go out there and say we're a health literacy company because no one knew what it was. If you look at the definition, health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services to make appropriate health decisions. And that's really a basic, if we don't have individuals that understand how to use basic health information and make better decisions, that's low health literacy, that's complications in their health, it's very poor prevention and wellness or managing their active diseases. I'd like to go ahead and play a video that is talking about why we started EdLogics, and this is not promoting EdLogics, we're the platform that we've built that's going to allow us to actually connect Hampton Roads. And we're a national company. We have GE Aviation. We have Allegheny County, 18,000 people in the school system. I met with the Port of Virginia yesterday. We have people from the port here. I met yesterday, and I was told that I could mention that the Port of Virginia is going to be joining the Hampton Roads employers. You're going to hear from Les Hall. So, yeah, we're excited to. The Port of Virginia is a very important company, and we hope to have a number of companies. Town Bank's been on our program for 3 years, but we're trying to get into the community. That's really where the action is building healthier communities. So I'd like to go ahead. You're going to switch my mic out, but I'm going to go ahead and play this video real quick. And this is just a 90-second video.
Low health literacy impacts 90 million Americans and costs the U.S. economy as much as $238 billion each year. It is one of the most widespread barriers to achieving better health outcomes and is a major driver of escalating healthcare costs. EdLogics has developed a results-based, gamified multimedia approach to improving health literacy, designing web and mobile-compatible games and tools to make learning about health fun, engaging, intuitive, and effective. We help individuals manage chronic conditions like heart disease, diabetes, metabolic syndrome, and sleep apnea, learn how to take their medications, and make better healthcare decisions. Because when people better understand their health, they make better decisions. And when they make better decisions, healthcare costs go down. We don't just make learning about health fun, we verify that people are actually learning. We measure knowledge improvement and allow employers to target specific individual needs and challenges. Our innovative incentives and rewards promote employee engagement, teamwork, competition, and loyalty, leading to a healthier, more productive workforce. On average, 80% of our users have said that they will change their behavior based on what they have learned, driving down the costs of managing costly chronic conditions, or even preventing them altogether. See how EdLogics empowers individuals to manage their health, get preventive care, and make fewer health claims. A healthier workplace, more productive employees, lower healthcare costs for everyone. Learn how EdLogics can improve the health of your organization today.
Hopefully you guys enjoyed that real brief video, and it talked about the employer setting, but as I mentioned earlier, we're really talking about all individuals in the communities. And we're starting here right in Hampton Roads. We're based in Virginia Beach. We're a national company, but we want to make Hampton Roads one of the most health literate regions in the nation. And we're doing that with our partners in Nashville. Scott Massey is going to be speaking today on what we're doing. The Global Action Platform is our 501c3 partner. I'm going to let Scott actually talk about the relationship that we've established, but we want to make Hampton Roads and Nashville two of the most health literate regions in the nation. And this is going to be not only shared around the nation, but around the world. And you'll hear the distribution that we have. We're going to be writing about the successes, how we involve the universities, physician organizations, health systems. And we have CHKD, EVMS, ODU, a number of players that are here. But we're really going to create a health literacy, a national model that's going to be taken out. We own URLs for Healthier Pittsburgh, Cincinnati, Atlanta, Richmond, Charlotte, the whole host, Raleigh, and we are excited about that. I'm going to just take a couple of minutes because at the end of the day, it's evidence-based information around chronic conditions where the money is. 86 cents of every dollar that you'll hear in a few moments goes towards chronic condition management. But we start with evidence-based information with our clinical team, our editors, our writers, and our partners at Vanderbilt University and Medical University of South Carolina. We take that, we build interactive health games, because at the end of the day, when I used to educate patients and give them a pamphlet, that didn't really work. It was too high literacy, people don't like reading, it goes right in the trash. When you pick up your drugs, how many of you look at your patient package insert? But you might watch a video of a virtual pharmacist right off our phone. And this is a mobile responsive device, but we built interactive health games. We have very credible low literacy multimedia educational programs. We have innovation gamification strategies, so points and leaderboards and challenges that we build into the platform. We know what people are learning about. We know that someone doesn't understand how to use Narcan to treat an opioid overdose. The following week, we will send them a video and say 10,000 points if you click on this link and watch how to use Narcan. So we can personalize the educational experience based upon the information that we know of your age, your gender, or your attributes. You may have a family member suffering from diabetes or cancer. We'll send that information to you, and everyone's going to have a different experience. We have targeting, so when there's key things that go on in the marketplace, we can educate and target our entire population. So Sentara was telling me, it was Jordan Asher who's here today, Tom, you're not really a health literacy platform, you're a consumer engagement and communication platform that happens to focus on health literacy. And you can do it on wellness, on safety, on health literacy, on financial literacy. But we have rewards and incentives, and you'll hear more about that. That's critical to what's in it for them. So there's financial incentives that are given to these individuals, and we're going to do that in the community. A big part of our strategy is innovative strategies, including incentives. And then health literacy assessment and assessing numeracy. If you're innumerate and you can't work with numbers, think about the people that didn't like math. If they can't deal with numbers, they can't manage their glucose control and insulin units. Robust reporting and analytics, I'll talk about that. At the end of the day, it's the data. We have data on individuals that no one else has in the world. The insurance companies don't have it. We know what people want, we know what they're doing, and we know how to personalize the education. We validate knowledge improvement. I'll show you some of that. We're mobile responsive. Most of the people are starting to use it on their phones, so we're very mobile responsive, and we're HIPAA compliant, highly secure. To get into Town Bank was like Fort Knox. To get into organizations like GE with the jet engines, it's not even to get in at Old Dominion University, now pilot that's going on. There's a lot of security that we have to run through. This is just a real quick snapshot of the data that we're collecting. We're tracking every click, but we're not selling data. We're using it to personalize the experience. So we know in this, the perceived knowledge, so we know what individuals think they knew and then thought they knew after, but we also document in the right-hand column on knowledge improvement, 67.4% increase in knowledge on health insurance, pre and post education. So we can go down further and we can actually look at which individuals don't understand the complications of untreated sleep apnea. And we can go right down to the questions and the polling that we will strategically roll out to Hampton Roads so we know what the issues are, what the feedback is, and rely on the community to help us build a healthier Hampton Roads. And with that, I'm going to just kind of jump ahead and introduce my chairman of the board of EdLogics, a friend of mine for years. I referred to him back in the day when he was in office as the czar of health literacy, and he's been a very big champion of this, and I'm going to let him give a little bit of his background. But Tommy Thompson was a four-term governor at Wisconsin and Secretary of Health and Human Services. So Tommy and I are going to tag team. We talked last night, and we've done a lot of presentations together. So over the next 20 minutes, 25 minutes, we're going to share with you what we've done around the country in the past and what we hope to do here in the future. So without further ado, I'd like to bring Tommy Thompson up, my friend and colleague. Thank you. Thank you. Get your mic right here.
Well, first off, let me thank Tom. Tom, as Nancy said, and Austin doesn't know how to take the word no. And he's persistent, he's intelligent, he's dedicated and passionate. And I love all of those attributes. And I thank Tom for inviting me down here today and being involved in really trying to educate America. Educate America about health care, costs, how to improve health care, and that's what it's all about. And I'm a poor lawyer from Elroy, Wisconsin. My community is so small, it's 1,500. You can call somebody, get a wrong number, still talk for half an hour. And I was lucky enough to get elected governor 4 times in the great state of Wisconsin, and then I went on to become Secretary of Health under George W. Bush. When I walked in on my first day as secretary, he said, I promised the people of the United States that we were going to give the elderly drug coverage. Remember that big issue of drug coverage? And he said, I don't know anything about it. It's your responsibility. Don't fail. Get it done. I don't care how you do it, and so on. But we sat down, came together, and came up with Part D, which is the biggest improvement in Medicare. Most of those were ideas that came out of my department, and I was the quarterback that had to spearhead it through. And it's turned out to be an extremely successful program. And I also was the father of welfare reform that President Clinton took over and passed nationally. Never gave me any credit, but 80% of it was my ideas. But anyway, he said, President Clinton has said that was his biggest accomplishment, was welfare reform. I don't think it was, but it was one of many. And so I've been involved, but what I'm working on right now are 3 major issues. One is healthcare containment and costs in education. And that's why I'm chairman of Tom's company, EdLogics, and I'm very proud of that company, very proud of Tom. Second one is my fight to try and make people aware of pancreatic cancer. It's a deadly disease and nobody knows anything about it, very little about it, and my 2 younger brothers both died from it. So I got a vested interest, and I can remember my brother asking me before he died if I would do something about it, and I'm dedicated to get that done. And the third thing is turning prisons into universities. That's a big one, and I'm trying to get that accomplished, start in Wisconsin, to be able to do that, be able to reintegrate prisoners back into society. But today we want to talk about how we really educate the public. And as Tom has pointed out, about 133 million Americans have one or more chronic illnesses. And it's costing just about $250 billion that we can do something about. And when you walk into a doctor's office, and you're a woman, and the doctor says, you got breast cancer. Or you're a man, and you walk in and say, you got pancreatic cancer. Do you remember anything else after that? Absolutely not. It just takes over. How can I have breast cancer? How can I have pancreatic cancer? What am I going to do? And the doctor will sit there and explain to you, you know, what he's going to do. But by the time you get to the car, have you remembered anything at all what that doctor said? Absolutely not. You completely forgot. All you can know is that I got pancreatic cancer and I'm going to die. Or I got breast cancer and I got children. What am I going to do? And so EdLogics, or education, is what can come in and help you. And then when you're in a doctor, I found this absolutely amazing. A doctor gives you a prescription. 27% of us never fill it. 27 never get the first script. Then you go in, you're sick, you get a prescription, and you don't fill it. I don't know the reason. Probably you're confused, you don't understand it. All of these things are why we established educational literacy. That's why we're trying to educate America as to how we can really get out there. And Tom's got an idea. You know, gamification. People love to play games. People love their computers. And when you're sick, what is the first thing you do? Before you go to the doctor, you look up Google, don't you? Most people go in and see the doctor and they think they know more about the disease, Nancy, than the doctor. And they give their opinions. But how do we really get the education out there? How are we going to be able to do that? And so we're going to talk about that today. But the cost is tremendous. 80% don't understand what the doctor says. 27% never go to pick up their script. 133 million Americans have one or more chronic illnesses. And most of those chronic illnesses can be changed by changing human behavior. Can you imagine how much the employers could save if we started changing and bending the curve on chronic illnesses? We would drive down the cost of health care. And we would be able to nationally do more research, more development, maybe find a drug for pancreatic cancer. So all of these things drive into what's costing and driving healthcare. And one of the biggest things that we need to address is the lack of literacy of understanding how we deal with healthcare. That's why I'm so excited about Tom's company. That's why I'm so excited about being here, because we're finally bringing a group together that extremely motivated at a campus, ODU, tremendous university. What better place to come here and have a cup of coffee with experts like Austin, Scott, Nancy, and all of you, and discuss how are we going to change this community. And we're going to talk about that in a few minutes. But I do have one gripe. And the gripe is you stole our battleship. I was governor when we recommissioned BB number 64, Wisconsin, the greatest fighting ship ever. And when they decided to decommission it, I went all over to Washington to find out how I could get it in to Wisconsin. They said, how are you going to float it up there? And I said, I don't know. We're not going to redo the St. Lawrence Seaway for you, Tommy. Well, can I go up the Mississippi? It won't go. It's going to get stuck. And you don't want it in Mississippi. Then I was trying to figure out a way to fly it in. And I couldn't. And so we ended up having to give you one of our birthrights, the battleship. And you stole it, but I love it. And I've come down and you've done an excellent job. So thank you. With that, Tom, do you want to give an individual cost?
Sure. And Tommy and I, as I mentioned last night, we came in and he directed me, and he is my boss. You can hold that. We're going to tag team this. We're going to share the next several slides together. But as Tommy said, $238 billion a year to the U.S. economy due to low health literacy. But this slide indicates what it costs on an individual basis, up to $8,000 a year annually for a person that has low health literacy compared to an individual with high health literacy. This was a Yukon study back in 2007, and this really is not just low-income people. It's not those people that live in Park Place that we hope to have a big difference in, but it's the North End, it's Bay Colony, it's all over, and we're not discriminating about making this platform available to the people in Suffolk, to the people in the peninsula, to the people at the beach, and right here in Norfolk and Portsmouth. There are heat zones where low health literacy. There's a lot of red in the Hampton Roads area. There's yellow, but there's some green areas too. We hope to change that heat map, and people are starting to look at health literacy as a balance sheet issue. And that's why we're going to talk with Jim Spoor, is going to talk about economic development. But on an individual basis, this is a major problem, and we can make a difference by increasing health literacy and reducing healthcare costs. And this slide here is, I'll take a kind of initial stab and then let Tommy have his comments on it, but this is our population health management strategy. Those that are clinicians here know that everything is trying to shift the curve to the left. If we can take people with risk factors and get them into a no risk or a low risk population environment, then we're going to be winning in this. But as you can see, 20% of the population is responsible for 85% of the cost, and that's in the area of active disease. So prevention, wellness, awareness, to change behavior, as Tommy said, so we can shift people over to the less costly area where the bulk of the people are and the less cost. But Tommy, you might want to comment on that slide as well.
First up, 90 million Americans, 90 million, have preventable health diseases. And with the right literacy, the right prevention program, we could absolutely change that. We could eliminate it if we all were dedicated. And the second thing we have is 93% of that $3 trillion, 20% of our gross national product, $3 trillion goes for a disease system. People call it a healthcare system, but it's actually a disease system. We wait till you get sick, don't we? And then we spend millions of dollars to try and keep you well or keep you alive. And only 7% of that $3 trillion is actually put into a healthcare system or prevention. So if you just change the curve a little bit, the 90 million Americans that have preventable diseases, and get them educated, help them prevent it, stop smoking. You know, and I don't want you to not take food. I just don't want you to eat it all. There is no law in Virginia or Hampton Roads that says you have to clean a plate. Do you ever think of that? You know, be generous to the host and hostess of your party. Take everything they put, but only eat a quarter of it, and you lose weight. Healthcare, smoking, obesity, several cancers. can be prevented very easily if we do the right thing on education. And as Tom pointed out, 80%, just think of this, 20% of the population, 85% of the cost. That's startling. But I'll give you even a worse figure. 5% of Americans cost the system 45%. 5% of the population costs 45%. $3.2 trillion. That's $1.5 trillion for 5% of the population. Isn't that somewhat disproportionate? And we all complain about drug costs, we all complain about hospital costs, doctor costs, but the truth of the matter is, we got it in our hands, our control, to be able to change that. And Tom and I were involved in something about this 8 years ago. And I can't say that we were that successful, but we tried on obesity. And we went to the city of Cincinnati, and we tried to get a collaborative and a multi-stakeholder integrated community-based model, just like we're trying here in Hampton Roads. But this was 8 years ago. We presented it on obesity, of getting employers, getting the universities, getting the church groups, college kids, all of them together. And we went up there, Tom and I, and gave the Tom and Tommy show. And we were well received. And it started off with a bang, but it stopped like everything else. People got tired of it. So we're now trying to figure out a way in Hampton Roads, and in Nashville, and in Elroy, to be able to come up with a vision. Our vision for Cincinnati is no different than our vision for Hampton Roads, no different than our vision for any community in America. So multi-stakeholder, which is all of you, and what better place than a well-educated, well-resourced area with many diverse people, to be able to come together and really want to make your area healthier, your population healthier. And that's what we're doing. So multi-stakeholder, community-based program that bridges the work site and the community. And we all of us, or not all of us, but a good share of us are employers. We have a lot of employees that come in, that have got health problems. They don't know how to take care of it. They're there, but they're not very productive. Now, if we're able to treat those individuals, get them better, they're going to be more productive in the workforce. They're going to be able to do a better job. They're going to be able to shuck more peanuts, George, and clean more. And you're going to be able to have that. So that's what we want to do as a community health and wellness platform, which provides a vehicle for increasing the awareness, the communication, and the most important one is the education, the engagement, and then the ultimate is change people's behavior for the better. Walk, eat properly. Don't do something that's going to be deleterious to your health. And so with that, turn it back to Tom.
Sure. Some of the big challenges that we had and the attributes of a successful model that we talked about, and we got a lot of interest. We had 200 people. This was a big event in Cincinnati, and it started, but the investment into the platform, the vehicle that was going to allow the education, just wasn't there, and we realized how hard it is to accomplish something without a technology platform. And that really was why we started EdLogics 6 years ago, is to build a technology platform. We've invested $15 million over the past 6 years on a very powerful platform that can educate, engage, and collect metrics and get smarter as we go. And focusing on chronic conditions, there's a lot of wellness and prevention companies out there. We were focusing on the difficult area. It's easy to have a Fitbit to track steps and do exercise and eat well, and there's 1,000 companies and new employers have those. We went into chronic condition management, very complicated, for that active disease with that 5%, so we can get people to better manage their chronic conditions, their diabetes. But we knew that the key attributes of a successful model required broad engagement of all stakeholders. And this room is filled with multiple different kinds of stakeholders. And there's a lot more out there in the community. And those cards that Nancy talked about, we want to know other individuals. A lot of people couldn't be here. They had conflicts. But stakeholders is key. The multi-pronged approach that will be sustained over several years. This is not a shot, just kind of a quick hit. This is a long-term sustained over years, and we're putting the resources in place to do that. It needs to have incentives to maximize engagement. Keep in mind, these were shared 8 years ago. So they're the same incentives that we would talk about if we were creating a presentation today. And these are the actual slides that we use. They don't fit the rest of the group. But incentives are key. It has to be a what's in it for them. How can they actually win, not just from improving their health, but from getting financial incentives, gift cards, cash, other kinds of incentives. The use of, effective use of social media to create a movement. So when it was buckle up for safety, when there's all those Smokey the Bear and all those types of things, we'll have social media, we'll invest resources to really start people to start thinking about health literacy as a really critical factor, not only for themselves, but for their family members that they're managing. And then establishing clear and specific goals and have the ability to measure progress against those goals, that's what the platform does. We'll go out, we'll assess, and we'll look at improvements. We'll identify areas, and we'll get Hampton Roads to work together once we get this out there, so all of the communities, all the Healthy Suffolk, Healthy Chesapeake, Healthy Virginia Beach are all going into opioid and addiction issues and mental health. That active disease, mental health is one of the biggest issues that we're going to be dealing with. We just launched a mental health hub about 3 days ago on the platform. But we can measure against those goals, and Tommy can talk a little bit about some of the challenges that we shared with the group in Cincinnati, and the same challenges we want to share with you.
In order to win, you got to be an integrated kind of community that wants to do something. If you don't want to do it, it's not going to happen. And you can't have the silo mentality in which I don't need that kind of help, or I really don't want to be involved in it. You got to have the community that really wants to do it. And you got all those disparate groups right here today, led by ODU. What better campus? You know, the Old Dominion University wants to be part of this. And as Nancy's pointed out, they're a very innovative campus. They want to try new technology, new innovations. They don't want the silo mentality. They want an integrated type of thing in which all the community comes in and be part of the solution. So that's very important. Nancy, you know, has taken the mental health issue and has developed a company around it. A very fantastic little startup company that wants to address mental health. And you know, I can look out and I'll state about myself. Every single person has some kind of mental health problem. You know, it may not be manifested to such a degree that you can't operate, but you can't tell me that some days you're not depressed. Some days you got a lot of problems that you don't know if you're going to handle. You know, but you're able to do it. So you're not paralyzed or any way or have to be institutionalized, but we all have. You know, we could all have a little integration, a little help, a little counseling, a little encouragement. You know, Austin said it, his wife never doesn't know how great he is. You heard him say that, right? You know, and he would like to bring her to one of these things when he gets introduced so he knows, so she can listen to how important he is. And that's all of us. Don't we all want a little encouragement at times? It helps. So get rid of the silo mentality, help each other. The data integration and measurement is so important for us to have the reliable data. Like Nancy's performing in mental health, like Tom is doing in EdLogics. And I bet, George, like you're doing in your manufacturing concerns. You're bringing those all together. I know how big your company is. And you couldn't do it without the data and where you're going to have to ship and the integration. All of that is part of your successful company. But every single one of you I could point out, if I knew a little bit about you, like I know about Austin, how important he is, we could do the same examples. You could all be part of it. Pressure for short-term financial results. 90 million Americans have preventable health diseases, and that's a conservative figure. $280 billion, just, right there that we could take care of. Put over into a pressure for short-term financial results.
I was
Yeah,
just,
very
I was
important.
just texting you and saying we only got 3 more minutes. No, I'm kidding.
That's true. And support of the local government, community organizations. That is what it has to be. So we do it. There's a mission, and I think we should do it.
And I just want to kind of comment on these last, the need for infrastructure investment. We've done a lot of the infrastructure investment. We're going to be launching with the platform, a Healthier Hampton Roads, but we're going to have continued investments that we need. We'll talk about that as we move forward. And the support of local government and community organizations, that's key. We have great community organizations that are here. Economic development, Aaron Rouse from the city of Virginia Beach as a municipality, and thanks for coming, Aaron. The various municipalities, Virginia Beach has a $200 million a year healthcare spend. They can cut into that by educating those people. With the horrific event that just happened, we're building active shooter education. We're building anxiety modules. We're building stuff that's going to address what's happened in Virginia Beach and put it in the hands of those people that are going to need that. So those are the kinds of things that we're doing, campus safety on university campuses. So getting communities to be involved as employers and as supporters of this is going to be critical. But our vision, and Tommy, I'll let you kind of finish up with our vision for Hampton Roads.
This is really a vision for a community. Somebody wants to lead, and a community that really wants better. And all that I've learned about Hampton Roads communities is that you guys are on the cutting edge, that you want to do things better for your overall community. And that's what makes it. And so the mission, let's just go through it. It's a multi-stakeholder, integrated community, which Hampton Roads is. It's a base program that bridges the work side of the community, which is, we got all of those disparate groups here. It connects Hampton Roads through an interactive digital health platform, which EdLogics is setting up. And it provides a vehicle for increasing awareness, communication, education, engagement, and behavior change. And that's what it's all about. It is so simple if we all work together. It is so hard because you're dealing with people's health and people's time. And that's why I'm so delighted with so many of you coming here this morning. And I thank you for it. Because it tells me you want to do something. In Hampton Roads, there's not a better community in the country that could start something like this and do it for the betterment of the overall community, save money, be a healthier community, a happier community, and a better community. And that's why we're here. That's why the program's set up. And I, on behalf of my former career of being the Secretary of Health, I thank you very, very much.
Great. I'd like to go ahead and thank Tommy again for coming to Hampton Roads. He's been here before. He's toured the battleship. He's still a little, when he saw it last night, I saw a couple of tears coming down. But yeah, he said, look at the size of those guns. He said the shell on that is as big as a Volkswagen, and it can send a missile 24 miles. A shell. 24 miles. But we appreciate you coming, Tommy. We're glad you're going to be here. We have a whole host of other great speakers that are coming up, and I'd like to just begin by ending this presentation here with what we're trying to do with a Healthier Hampton Roads. Hopefully what we shared with what we're trying to do in Cincinnati, it's the same vision. We just replaced Cincinnati with Hampton Roads and a health and wellness platform that we didn't have with a digital health platform. But I'd like to go ahead and introduce a friend of mine, Scott Massey, who was here about 6 months ago at the Maine. This is the second forum that we've had. We had Jim Spoor, who you'll be hearing about in a few moments, speaking. Scott came up from Nashville, but we've partnered with Scott. I'm going to let him go ahead and talk about what we're doing in Nashville and how Global Action Platform is going to be critical to the success of what we're doing here in Hampton Roads. So Scott, it's all yours. Thanks. Scott is the CEO and chairman of the Global Action Platform. Thanks, Scott.
Very good. Well, if we can build a boat that shoots a Volkswagen for 24 miles, surely we can help our fellow citizens be healthy, you know. Surely we can do that. As you have already heard, the challenges of health in this country are tremendous, both on the human side. These problems are human tragedies. The lives that are cut short or the lives that cannot be fully lived because of health challenges that are preventable is a human tragedy. It's also an economic time bomb. When you look at the aging population and the costs that will be associated with that, when you look at the problems of managing chronic disease and maintaining a healthy population, and when you look at the exploding costs in dealing with epidemics like the opioid epidemic, which we haven't even really talked about yet this morning, but the costs for that are going to be astronomical. We're going to have to find a way to solve this for economic reasons as well as for human personal reasons. So these are some of the reasons why we at Global Action Platform are delighted to be partnering with Tom and EdLogics and you here in Hampton Roads to try to create a model for how communities can address these challenges. Let me start by telling you a little bit about Global Action Platform to explain who we are, how we're going to be a partner with you, and how we think about approaching this whole issue. Global Action Platform is an international university business network. Our mission is to advance scalable, sustainable solutions for abundant food, health, and prosperity. We have been looking over the last 5 or 6 years at how do we change from a society dedicated to health care to a society dedicated to health. And so we were very excited when we learned about the EdLogics platform because we saw that as a strategy that could really help make that pivot, make that turn from healthcare to health. Global Action Platform has been organized to operate through 4 primary program areas: convene, challenge, connect, communicate. Our convening activity is anchored in an annual summit, which is moderated and hosted by Fareed Zakaria of CNN each year. In addition to that, we do an annual event, an annual leadership forum with the World Bank in Washington. And since the launch of the Sustainable Development Goals at the United Nations in 2015, we've been a partner with the UN and do an annual leadership event and release our annual report at the opening of the General Assembly each year in New York City. Occasionally, we do some work with the National Press Club over issues that we feel are of media interest and consequence. And we do a university business showcase in Nashville to bring together our 10 major research universities with the business community and the investment community for that region. In addition to our convening activities, we've partnered with a number of impact investors over the last 5 years, invested a little over $9 million in technologies and new companies that we felt could have a transformative impact on food, health, and economic development. This is an area of activity we want to expand because we don't want to just bring people together, talk about ideas, talk about problems. We actually want to try to put our money where our mouth is and make changes that can be scaled and sustained. Connect, we've partnered with a number of technology companies, built collaboration platforms. This one with EdLogic is a wonderful example of that. We're currently building a research search engine for our region that we're also going to be taking nationally and internationally so people can find what the research capabilities of their area may be. Businesses can partner with universities around that and communicate. We've partnered with the Diplomatic Courier to do 2 publications a year. These are mailed to 25,000 leaders around the world. 5 million people read them online. So by communicating globally, leveraging technology, making impact investments, and informing, inspiring, and mobilizing leadership, we've tried to have an impact on food, health, and economic development. We've now worked with over 400 of the world's top experts, executive leaders. We've built a knowledge base. We've identified key areas of interest and challenge. And as a result, we have been pivoting to look at strategic partnerships, particular projects and initiatives that we feel could be scaled and could have major impact apply the lessons we've learned, apply the knowledge, the expertise, the relationships we've developed into actually doing something. So that again is one of the reasons we're so pleased to be the strategic nonprofit partner with EdLogics, to look at how we mobilize community support, philanthropic support, and community organizations in a collective impact, shared vision, and project to change the health of Hampton Roads. This is a model of collective impact, which some of you may have seen. Collective impact is a new approach that Mark Kramer from the Harvard Business School, Mark is a member of my steering committee, we've been working together over a number of years. The idea is that the challenges we face in our communities and our country today are so big that single institutions, single sectors, single efforts are not enough. We need all of them working together. And that's an easy thing to say, but a very hard thing to do. It's easy to get in a room like this and recognize the challenges that we're facing here in Hampton Roads and say, yeah, we all ought to work together. But then we go out and we're immediately being called on our cell phones or the email or the latest crisis of the day hits us, and we don't have the time or the energy or the ability to actually do the collaboration that we want to do and that we know we need to do. Collective impact is a strategy designed to deal with that problem. It's a strategy designed to bring together the multiple stakeholders, the multiple investments, the multiple resources and assets that a community has to solve a big problem that takes the entire community. At the heart of collective impact initiatives is a backbone institution, a trusted convener, someone who's not one of the key players themselves. Because as we all know, we all have territory issues and concerns, and when one of the local organizations says, okay, I'm going to step forward, I'm going to take the lead and organize everybody else, there's always a little bit of resistance and concern. Well, maybe they're trying to do this to benefit themselves, and maybe this is going to hurt me. How can we actually do it? So it's very critical in putting together broad-based community collective impact initiatives to have somebody who's a completely neutral player, a trusted partner who has no dog in the fight and can bring everybody together and try to find alignment and harmony among the different initiatives. That's the role Global Action Platform is going to be playing here and also in Nashville. In addition, it's critical to have an effective collective impact initiative to have a shared agenda. Now that takes time. People have to talk together. You have to really understand what each of the different organizations and initiatives in the community has to offer and start to see how the pieces of the puzzle can be fit together. That agenda has to be put together in such a way that nobody's really a loser. The idea is not to create a new set of winners and losers. The idea is to create an agenda in which everybody's part is important and valued and plays a critical role. In creating an agenda, you also have to start with some idea of the metric. We're going to measure the impact of what we're doing. So creating shared metrics at the same time that, that we're creating a shared agenda is a critical part of this. As you get the metrics and the agenda more defined, and that takes time, that takes a number of iterative discussions and planning sessions, then you can start to align the different resources and assets of your community into a real plan. And once that plan is launched, continuous communication among all the players and partners, so everyone sees how it's working and keeps redesigning. It's like I told Tom the other night, it's like technology or software development. It's an iterative, ongoing process. And so getting the community engaged in a clear, shared agenda with good metrics, but constantly then talking among yourselves and facilitating that dialogue and discussion so that your actions can really have an impact and start to change the health outcomes and statistics about this entire region. We're pleased, as I said, to be the strategic nonprofit partner. Tom's company, EdLogics, is a for-profit company. They're doing a great job, but for something like a Healthier Hampton Roads, you need a nonprofit partner that can bring in philanthropic support and all the stakeholders and can build out the infrastructure needed to make this happen. We believe, starting here in Hampton Roads, that we can create a model, a collective impact model, of how a community can use a technology platform like EdLogics to start to change the health of an entire region, an entire community. This will build not only a better quality of life for the people who live here, but it will be a major economic driver. We're working, excuse me, with an area in Tennessee right now that cannot recruit companies to move into their area because the health statistics are so bad that they're afraid they won't be able to have a sustainable workforce. So they can't grow economically because of the health data about their region. So this will help this region economically. It will help this region from a quality of life point of view. And we believe that starting here will then create a parallel program, collective impact program in Nashville. We also have a few healthcare assets, including some buildings that Tommy owns, I understand, in the medical area in Nashville. And in addition to being the bachelorette capital of the country, which Nashville, I understand now is right now, we also happen to be one of the healthcare capitals of the country. So we believe we have some unique assets in Nashville that can be brought into this. And partnering what we're learning and doing in Nashville with what you're learning and doing here in Hampton Roads, we believe we can create a replicable model that we can then take to other communities. And what a wonderful reflection that will be on Hampton Roads once we're down the road doing that, to say, this started here. The company started here, the initiative started here, now look what it's doing all across the country. So, Tom, it's a pleasure to be here with you and to meet all of you. We look forward to working with you.
Awesome. Thank you. Thanks. Yeah, thank you, Scott. I can't think of a better partner than the Global Action Platform. They're moving into action, and I can't think of a better city to partner with as Nashville. Nashville is on the map, as he mentioned. If you think of what city is the healthcare city in the country, it's Nashville. That's where the assets are. That's where the excitement is. But I'm really excited that 5 million people around the globe are going to be understanding how Healthy Hampton Roads was the impetus, the model with Nashville to make a difference around the nation and ultimately around the globe. So we're really excited, and again, Scott, thank you for coming up from Nashville. I'm going to shift over to our next speaker, and Jim Spoor doesn't need a big formal introduction. Jim is well known to everyone here. He was the city manager of Virginia Beach for a number of years, but he's CEO of Reinvent Hampton Roads, and we're going to keep on track, and I'm going to turn the program over to Jim Spoor. So Jim, thank you very much for being here.
Good morning. Thank you all for being here. I'm here and delighted to be here because this is a topic I really personally believe in, and that is health, wellness, health literacy, and so on. One of the practices I've noticed is that every hour you should stand up. So I don't know about you, but these chairs are like killing me. So why don't everybody just take 15 seconds, stand up, and stretch a little bit. Doesn't that feel great? Okay, cool. Well, good morning. A lot of people don't, you can keep stretching too while I'm talking. A lot of people don't make the connection between health literacy and an economic development strategy, but there is a very strong connection, and Scott started to get there at the end of his presentation in terms of that connection that I hope I'll make clear. And I want to Tom asked me to take a couple of seconds and just tell you a little bit about what Reinvent Hampton Roads is. And let's just see a show of hands, and I won't be offended if you don't know. If you know anything at all about Reinvent Hampton Roads, raise your hand. That's amazing. That's really pretty good. I didn't think it'd be that much. We are a nonprofit organization. We're also a 501c3, and we were formed in January of 16. really to change the economic profile of Hampton Roads, and I'll tell you why in a minute. We're funded by those groups that you see there, the Community Foundation, the State of Virginia through the Go Virginia program in Port of Virginia, the Business Roundtable, and some individual support as well. There's our board of directors. It's some of the top business leaders in this region are really pulling together. It's a great board focused on our mission, which is to create more higher paying jobs in this region. Very important. Our approach is we want to be comprehensive. We believe that the region is the fundamental unit of economic performance in the United States and around the world. It's a system of systems. Certainly we're talking about one today in terms of the healthcare system, critical system that plays into our overall competitiveness. We partner with others. We stress alignment, and Scott was talking about the importance of that in terms of the collective impact model. We very much believe in that. Reinvent Hampton Roads has no authority to tell anybody to do anything, and that's the way we like it because that's our strength. We bring people together to make things happen, focus on actionable solutions. Why is this important? Why were we formed? This shows you a graph that depicts what happened in the United States and Virginia and Hampton Roads following the Great Recession. And the Community Foundation noticed that, hey, it seems like we're not recovering like many of the other areas in this country. And in fact, we studied that and we weren't. The nation and Virginia returned back to where it was before the Great Recession after 77 months in the end of 2013. Here's Hampton Roads. We just got back to where we were in 2007 in the middle of 2018, over 11 years. So we need to focus on our economy. How about job growth? There's Hampton Roads, lower than Virginia, half the rate of Richmond. There's our buddies up in Nashville, leading the country in terms of job creation. Migration, people vote with their feet. Last year, we had over 5,200 people, more people leave this region than came into this region. Tommy, there's Milwaukee, Wisconsin, is the worst in the country. There's our friends in Nashville again, almost up at the top. Orlando's adding 40 or 50,000 people a year, and we're losing 5,000. Got to do something. So we came up with a new model of economic development. What's this all about? The old model is on the left. We used to go out and whale hunt. We'd go out and try and attract firms from Nashville to move to Hampton Roads. And we found out, you know what, that's not working, and we needed a much more holistic view of economic development. So that's represented on the right, and it's much more holistic approach. At the top of the list, the most important is workforce talent, and I would say above that is leadership. So we've been focusing a lot on all of those elements on the right-hand side. So it's all about workforce. Quantity, availability, quality, skills, productivity, and guess what? Health. Health of the workforce impacts every one of those. Quantity of workforce, availability, if you're sick, you can't work. Quality, if you've got a chronic illness, you're not going to be a quality performer. Here's what some businessmen said about business and health. 79% of the businesses cite a healthy workforce as a key factor in guiding locational choices for new facilities and deeper investments. 98% of businesses responded that knowledge of an at-risk population, this is the Tennessee example that Scott was talking about, above average incidence of chronic conditions, et cetera, would prevent them from building a new facility in a location. Unhealthy employee costs the company about 3 times as much as what a healthy employee does. And only 3% of the federal health budget is spent on public health measures. Local municipalities must carry the weight, so here we are. We talked to a lot of you, many of you in this room and others, about what are some key topics that we need to be focusing on, aiming at, if we want truly healthy communities. Mental health and trauma. 1 out of 5 young people has a mental health issue today. Chronic disease, diabetes, obesity, heart disease. 1 out of 11 Americans has diabetes. Substance abuse, opioids, 50% more people last year died in the United States than were killed in the entire Vietnam War because of the substance abuse problem. How do we stack up? Well, in 2014, we did a project called Envision Hampton Roads, and we went out and we asked people, you know, what's your thoughts about this subject, and what should we do as a region? They said, we want to develop a regional initiative that promotes a healthy community for all of its residents. Gee, that's an idea. We want to promote social and economic benefits of living in a healthy and productive community. We want to examine, explore components, and there they are: physical activity, nutrition, tobacco, substance abuse, mental health. That's the whole ball of wax that we're talking about here today. So our aspiration that was expressed by the probably about 3,000 people we talked to 5 years ago was that we really wanted folks to be provided an opportunity to live healthy lives. Here's some data. This is from the Center for Disease Control, comparing various cities in Hampton Roads and a few of our national peer groups that we look at. We don't stack up too well. There's Portsmouth, Hampton, Norfolk, Newport News, for example, on the left side of that. And the higher the bar, the worse the condition. This data is from our partners at the United Way of Southampton Roads. They've got a fantastic dashboard that they have put together, and a lot of you are collaborating and putting information into that. This is one of the sample panels from that. This happens to be for the city of Norfolk, which out of the 133 locations in Virginia reporting this data, that's every county and every independent city, Norfolk ranked 129th, so not very good. Portsmouth is 132nd out of 133. So some really serious community health issues in this region. And if you read the ranking is based on a summary composite score calculated from the following measures: adult smoking, adult obesity, physical inactivity, excessive drinking, alcohol-impaired driving, blah, blah. You know what? Most of those you can control. You can do something about those. So we can change this needle, and we've got the data set with the dashboard and with the EdLogics platform to be able to make a big difference in this. I see Luciano Ramos here, which he has broken his pick putting this together, and it's some really good stuff. That's, that's the bad news. The good news is, I think we're really well poised to use a digital health literacy resource to make a difference in that. So if you look at access to computing devices, more good news. On the high end of the scale, York County and Virginia Beach, you see 94% of the homes have access, or folks have access to digital technology. Even on the low end with Franklin and Portsmouth down in the mid-80s, you know, we've got a lot of folks that have got a lot of digital capability in this region. We're in the process of building a high-speed fiber access ring that would connect every city, every major municipal and school facility in the region. So we've got the ability to make this digital connection, digital platform work. Health management in the workplace, you know, if you think about it, it's really, for me, it's those lifestyle choices that are going to make a healthier person. That's what drives and motivates me. But you know what? They are going to be a better employee. They will improve their job performance and the gains for the organization in terms of, you know, all of those costs: absence, disability, workers' compensation. All of that is positively impacted. So from my standpoint, in terms of trying to develop an economic development strategy that is comprehensive in this region, this health literacy piece, the health of the workforce, the nature of our workforce is important, and I think that we can really facilitate that and make that a game changer for this region. This region needs to be known as a region that cares about health and wellness. If we can do that, it's going to be good for our economic development future. So let's work together to become known as a healthy region, and it's a classic win-win situation. So thank you very much.
Yeah, thank you very much, Jim, for that concise presentation of a lot of information. I'd like to thank Luciano Ramos from the United Way to help put some of that data together. We're working with the United Way. We're working with the Brock Institute. Matt Herman is here from the Brock Institute, Dr. Cynthia Romero. There's a lot of organizations that are behind what we're presenting today. So this has been a collective impact presentation, if I could steal that concept away from Scott. But I'd like to go ahead and we also think it's a classic win-win for everyone. And I think, Jim, did you take the clicker? Or is it? So, yeah. Yeah. So making it tough on me. I'm not even a technology guy, but I've learned a lot about technology. My daughter, Brooke, was the reason we started EdLogics, actually. Brooke is over here on the left. She's our product owner. We have a group of 30 people with about 50 people total, but 30 full-time people all around the country. But one thing we didn't mention is the summit that actually is going to be taking place in Nashville. And I've spoken about gamification in the U.S. to a worldwide audience. We're working with Kurt Krause and the Visit Norfolk group to hopefully have the international summit next year right at the Main, or right in Hampton Roads, and talk about all the great stuff, all the data that we can actually change the dashboard of the United Way, the hemoglobin A1C levels in various cities of Hampton Roads, and make a difference on the data sets that Jim just presented. So that's really what we're trying to do, is get everyone working together. We've done a lot of work behind the scenes, and we have a group of people that are going to help us continue the discussion over the next hour or so, and we've been really fortunate to have individuals like Dr. Dimi Barot, a neurologist, a national sleep an international sleep health expert, who's going to be talking about the impact of health literacy and talk a little bit about one of the 4 pillars being sleep health. So we're going to hear from him on sleep health. We want you to go away and getting something personally out of this 3-hour presentation. Les Hall, Les is the president and founder of Allfirst. He's also on the board of directors for Sentara Healthcare, very active in the community. Les was the first company that put the platform in place. I said 4 years ago, he said maybe 5 years ago. So we started with our prototype, and he's been on the platform for the last 4 years. Town Bank's been on it for a while. But we work with our employers, and we're not a for-profit company. We are investing into this. We're building a platform. And we want to hear about how this platform can help with Angela Reddix talking. She's the CEO and founder and president of Ardex, an awesome company that's right here that's doing great things in mental health and really going into those low-income neighborhoods and addressing the social determinants of health. And also Bonnie Van Loonen, the dean of the Old Dominion University in the College of Health Sciences. Bonnie was one of the first people that President Broderick and Austin Agho got me in touch with, and we've been working with Bonnie. That brought us to Nancy and a whole host of people on the campus. Actually, Dave Jester was responsible for introducing me to President Broderick at a tailgating party. And when President Broderick heard about health literacy, what we want to do is create a center of excellence in health literacy and use a digital platform. There's centers of excellence that are popping up around the country. Vanderbilt is probably our leader. They're one of the leaders in the world in health literacy. Russell Rothman is probably arguably the #1 guy in the world in health literacy. He's on our advisory board. And so we're working closely with them. We want ODU and some of the universities to really play a role and make Hampton Roads recognized for what we're doing in health literacy. So I'd like to go ahead and ask our individuals that are on this slide, Dimi, Les, Angela, and Bonnie, to come up and share some of their experiences and their thoughts on building a healthier Hampton Roads. So if you guys could come up here, we'll continue our discussion in an interactive panel discussion. And as we do that, we're going to turn these mics on. And we have one over here that I'm going to start with Mr. Les Hall, my friend and colleague. And there you go on that. That's on. But as I mentioned, we're going to have 4 separate mini presentations. We're going to have time for Q&A of our panelists. But they all represent a different area. And that area is, from Les Hall's perspective, is the role of the employer and the community and what they can be doing as one of the stakeholders in this. So I'm going to go ahead and turn it over to Les Hall, and we appreciate you joining us today. Thanks, Les.
Thanks, Tom. So, again, my name's Les Hall. I'm with Allfirst. We are industrial general contractors. So I have millwrights, pipe fitters, welders, riggers, and we do no government work in this area. So we work at food manufacturing plants, oil terminals, power plants. So I've got the salt of the earth that I've been working with for 40 years. And I've got a few of them that I've worked with for 40 years. So the impact that I wanted to bring back to the community when I started the company, the loyalty that my employees have to me, and also that I have back to them, has always been a challenge with healthcare. So as healthcare costs have risen over the last, particularly the last 7 or 8 years, where we've had double-digit increases, sometimes 20, 30%, and they're paying half. As an employer, I'm paying half. Fortunately, we're a successful company, so being an owner, I'm proud to say I can handle that, my half. But their half, that's a challenge. You know, they're averaging somewhere between $20 to $35 an hour. They're on an income of somewhere between $50,000 to $85,000 a year, and having healthcare costs rise from $200 a week for their families to $300 a week to $400 a week, and we all know about co-pays and deductibles. So when Tom identified that this term, healthcare literacy, about 6 years ago, and we were good friends, and I said, Tom, what's healthcare literacy? We buy insurance, we pay our co-pays, we pay our deductibles. That's not our responsibilities as citizens. And that's where most of you in here were brought up, that we made our insurance payments. And after that, that was the end of our responsibilities to ourselves and to our families. Healthcare literacy, I was looking for a way to make a difference with my employees. One of the things that I honestly want to say, and I say to them, as those costs went up, and I did not have control over them, that's a fixed cost. That's the insurance company saying, we're going to raise 20%. One of the reasons I went with EdLogics was so that I could change the atmosphere in the room. Everybody's complaining. Everybody's bemoaning the insurance companies, the healthcare providers, the government, Obamacare, Affordable Care Act. Everybody's bemoaning that. Well, I brought in EdLogics and changed that rapport. So I said, yes, yeah, your insurance cost has just gone up, but look, we've got this fun game and this educational process. And so every day what happens is we get a scratch card, we play that health scratch card, and we have a conversation about good health practices, health literacy that has elevated and changed the perception with my group and motivated them to do that. So in a company that's a capitalist, we're out there to make money. Unlike most of the speakers today, I'm a capitalist. I have to charge, I have to make a product and get paid for it. But that's worked in my community, in my company. And so I think the prospect of teaming up with ODU and making Hampton Roads healthier with philanthropists and with community foundations and with support of corporate cultures, identifying that it's a positive movement for their employees, I think that's one of the reasons, again, we have continued to support the movement and want the movement to progress. You know, one of the things in looking at 6 years ago, do we really need health literacy? Well, I think if you look back at some other historical stories, nobody felt like we needed iPhones because we had never seen one. And it's one of the stories I say, and I feel the same way about health literacy. What do we need health literacy for? Well, it's just become popular or on the forefront the last few years, and what's it going to look like? We don't know. But I think this is one of the movements that can differentiate us in Hampton Roads and also be better for our communities. So that's my part.
Yeah. Thank you, Les. And Les calls me in the mornings and says, what did you think about today's health scratch card? But Les is very active. He plays on it every day, and his employees. And We appreciate and thank you for continuing to be a supporter and talking to groups like this on how we can make a difference at the employer. As we talked about, it's bridging the community, the workforce and the communities. It takes a whole host of individuals, including small, mid-sized, and large corporations. And I'm going to go ahead and shift over to an unbelievable individual that most of you know, Angela Reddick. Angela has really pioneered a lot of things, both here in Hampton Roads and on a national scale, both in the private as well as in the government sector. So Angela, we'd love to hear your thoughts on what you're doing at ARDEX and how you would like to help participate in Healthier Hampton Roads.
Absolutely. Good morning, everyone. Well, let me just say, this is a different audience from who I've been with all week. I'll tell you our ARDEX story, but we partner with Old Dominion University to bring 600 girls from 30 states who come from Title I locations to introduce them to entrepreneurship as a way of transforming their mindsets so that one of the social determinants of health, which is about economic stability and the housing in the community, that we can infuse a different mindset in them. So we've been working with them all week, and today is our pitch competition where they are eligible to win a prize. So I ran from there to here, so I have to change my vernacular. Okay, so hello. I tell you a little bit of story about ARDEX and how we fit into what we're talking about here today. I am a business owner here in the Hampton Roads area. ARDEX is a healthcare management and technology firm. We have over 100 associates, 120, 150, it changes every day, throughout the United States. And our focus is helping the federal government, specifically Health and Human Services, Centers for Medicare and Medicaid Services, implement national legislation. So we have been on the forefront over the last 13 years of implementing Medicare Part C, implementing Medicare Part D, and then back in about 2012, implementing the Affordable Care Act. So that is what we do day in and day out. But in doing that work, what we determined as we look at Medicare and the state of the Medicare Trust Fund, that at some point we all think that we turned 65 and we're eligible, that there's going to be this pot of dollars there. But what I know to be true, because I work on the finance side of healthcare, is that the Medicare Trust Fund is getting smaller and smaller every year. There are 4 chronic conditions that really eat up probably 80% of the cost. And so what we know, fundamentally, the cause of those particular chronic health issues has to do with healthy living, how we're living. We actually can impact that. And so when we formed the company back in 2006, and we were doing very well, working on behalf of the government, but I saw the dollars. And so we said, what can we do to help in the community to get ahead of this? It's not the time to help at 65. At that point, you're going to submit your claims and it's going to be what it's going to be. But how can we change it in the minds and in the practices of the youth? A lot of it has to do with healthy eating. So we started what's called healthcare academies, where we went into different communities that had high risk, and we did fun modules with the youth to try to change their mindset about obesity, about how they're eating, about exercising, et cetera. Then we realized we can talk to the kids all we want, but it's the leaders in the home, more than likely in these particular homes, there's going to be the mothers. If we don't change that mindset, then we're not really going to be able to influence the kids. And so we started women's wellness celebrations. So once a year, we pull women all throughout the community, and we have a day focused on what it means to be healthy. And we realize it's not just about physical health. We can talk about that, but the mental condition is really what is going to dictate how we perform in the home. And so we shifted and formed ARDEX Foundation, and we do all of these activities through ARDEX Foundation and changed our focus from physical health to mental health. That was 3 years ago. So now we pull women and professionals and the faith-based communities and employers together once a year, and we discuss how do we communicate what our needs are from a mental health perspective. We recognize that this has to be culturally competent because mental health is a very sensitive and personal thing. So people have to feel that you can relate to their story. And so we have sessions so that we can get the language to use in a way that's comfortable and applicable no matter what setting you're in. This year, we are so grateful to the partnership with Sentara. We've been able to add a component to Arctic's Foundation, which is working in the higher education arena. Because according to a survey by American Psychology Association, 94% of the counselors on these campuses are saying that they spend the majority of their time talking through depression and suicide threats on the university campuses. So if we don't do something there, we're really going to lose out on a very valuable asset. And these are the youth who are coming out of the university settings who could potentially be the leaders in our households and in our communities in the future. So we are going to be working with EdLogics to roll out a program at the university level where there's 16 hours of modules that we'll be having from the it's called an orientation session. So everyone, when they come on campus, they will be able to get face-to-face support through modules that we have counselors who are going to support. We will then partner to have a distance learning or gamification through the system that we're talking about today. And then they have hours that are allocated that they can actually speak with a live counselor. So for Arctic's Foundation, again, the basis is what we're seeing that's driving the cost of healthcare and getting ahead of it by helping the community so that we then can save the Medicare Trust Fund. I mentioned that we have a camp that is through Envision Lead Grow, which is a part of our overall portfolio of programs that we offer. Envision Lead Grow works with middle school girls only. And these middle school girls, because we know that if we can impact the way that they're processing and the way they see themselves, then we are also helping them from a mental health perspective. So before they're even eligible for college, they understand their own voice, they have more confidence, and they have a way of speaking about what they're experiencing. So that's a little bit about our story, and I'm happy to answer any questions.
Thank you, Angela. Yeah, the exciting things that she's doing, we're really excited to be part of what they're doing. Using our platform, not as just a one-on-one individual, because everyone gets their own account, but we can have a big screen and have 65 college kids learning about suicide prevention, anxiety, or elderly people in assisted living facilities learning about fall risk. And so playing games as groups. So it's really exciting that we can take this platform and use it in various types of settings, one-on-one as well as group settings. But we're excited with Norfolk State University, with Sentara Healthcare, and Les being on the board of Sentara. Obviously, Sentara is a major player in this area. We're excited to be able to be partnering and looking for opportunities to work with the Sentara systems, the Bon Secours, the Riverside, and individual practitioners. And one of our next speaker, Dr. Dimi Barot, who I just met about 2 months ago. Dimi it was really pretty cool. He lives in Suffolk, and I'm in Virginia Beach. I hadn't really heard about him. A couple of people put us together. We started meeting at Starbucks, and the next day we met again. And then we met again a few times. And I met his son, Arima, who is a very astute, very smart kid that is at NSA. And so we're partnering with, I don't know if Chris Grden is here from, Chris, are you here? Chris is here from Cape Henry Collegiate. We have NSA, Aria, right here, who's a freshman at 9th grade, 8th, 11th, all right. Sorry, I got my facts wrong, but you know, Aria is someone that we think our platform can be brought into the homes through the kids at the YMCA, at the Boys and Girls Club, and the access into the family. It's about a family health that we're talking about, so bringing them in. But I'm excited to have NSA and have Cape Henry Collegiate and some of the other organizations, the City of Virginia Beach school systems, because people will change if their kids are telling them to change. You know, do you really need to have that cigarette, Dad? Or do you really need to be doing these kind of things? So we think it starts with the youth, as Angela said, and 8.3% of college kids have thought about killing themselves. That's a major problem. That's why we went into campus safety and mental health and suicide prevention in organizations, and that's something that we have to address. But sleep health is something that I'm really fascinated with, and I'm going to have Dr. Dimi Barot talk a little bit about health literacy with a focus on sleep health and well-being. Dimi?
So thank you for the introduction, and thank you all for your time. I'm going to walk a little bit so I can follow one of our previous speakers and not be stagnant. Let me first take you, if you don't mind, through very quickly my journey, because I happen to be an alumnus of ODU. I actually finished at NSA and was fortunate to get into a 7-year honors accelerated joint medical program where Old Dominion was my undergraduate, and had a wonderful experience here. And then took a year off, went to EVMS. And during my time at EVMS, became most fascinated by the brain, because the brain, the nervous system, clearly the command center for anything and everything that has to do with human function, cellular function. And so as I got enchanted by the brain and thought I might do neurosurgery, and then realized that neurosurgeons have probably one of the worst lifestyles of any of the healthcare practitioners. My third day at UCLA, when I was scrubbed in on a 7-hour case, about 4 or 5 hours into the case, the neurosurgeon that I was scrubbed in, first of all, the first 2 days, both attendings that I scrubbed in with were divorced. This attending was separated, and so as we're talking, and I was about to get married in about 3 months, go to India, have our family there, big Indian wedding, a big fat Indian wedding, and a few hours in, he goes, just out of the blue, he goes, "Dimi, you seem like a really good guy." And I was like, "Well, gee, thanks. Where's this going?" And he said, "No, so why are you doing neurosurgery?" And I said, "What do you mean?" He said, "You have a good head on your shoulders. You have your priorities straight. You think about your family, your spirituality, your faith. You run every day. You eat well." I was raised vegetarian. I've always been vegetarian. If it weren't for cheese, I'd probably be vegan. So he said, "Why are you doing neurosurgery?" And I said, "What do you mean?" He said, "You know, my wife, I love my wife a lot. And we spent some time together, and we're separated now. And he said, the one thing that she wants from me, she doesn't care about the diamonds and the cars and the houses and this and that. The one thing she wants from me is the one thing I can't give her, which is my time." And I said, "Why not? You're an attending." And he said, "Well, you think life gets better after you finish your training, but if anything, it gets a little worse, because now you're responsible for everything. You're not just a student or a resident or a fellow. And so you have like complete responsibility." And so we had this conversation, and then I said, "Well, you don't really seem like an excited neurosurgeon to me." And he said, "Well, why are you doing neurosurgery?" And I said, "Because I love the brain." He said, "Why don't you do neurology?" And I said, "Well, because my daddy does neurology. I sit on my dad's shoulders. I want my dad to be proud of me. I want to take, my dad is a first-generation immigrant. I want to take everything that he's worked so hard to achieve, and I want to kind of expand on that so that I make my parents proud." And he said, "So what's wrong with neurology otherwise?" And I said, "You know, it's a very diagnostic-heavy field. The neurologist is kind of, he's the super sleuth if he's good at what he does. But then there's this saying that neurologists are kind of like diagnose and adios, right, Jeff?" So he's like, "No," this was 2000. So he says, "No, you know, the 90s have been the decade of the brain, and so many conditions that we thought were previously just kind of untreatable, or things like chronic migraines or myasthenia, or for that matter, even neuromuscular conditions like ALS, at least there was a treatment to slow it down." So he said, if I were you, I would consider a career in neurology because you can do a lot of good, you can help a lot of people, and you don't have to live a terrible lifestyle. So this was Wednesday. So Wednesday evening, I called my dad, and of course my dad, trying to play it cool, he's like, well, you should do whatever you want. And of course, like, I'm just imagining now, he's probably like having palpitations, like, my son's gonna be a neurologist, right? So the next day I switched my rotation to stroke neurology, great neurology program at UCLA, one of the pioneers in stroke therapy. And I decided to pursue neurology, but even in neurology, as I went through my training, I thought, you know, there's a lot of great stuff here, but again, it's very diagnostic heavy. I want to help people. I want to do good. I want to see results, and I don't want to be married to my profession. I want to love what I do, but not be consumed by it. So right around that time, I almost stumbled upon this field within neurology called sleep medicine, which many of you may have heard of. It's now, I would say, if it was in its infancy then, it's probably in its toddlerhood now. And what fascinated me was that maybe unknown to many, many, if not almost all healthcare providers, including neurologists, including sometimes, ironically, sleep specialists, is that sleep is so interwoven, as you would expect it should be existentially. Sleep is so interwoven into everything that we do, physical health, mental health, and everything in between, if there is anything else. That at an individual level, if you can solve for sleep, so to speak, you can really solve for health. And I know that sounds like a very bold statement, but forgive me, I'm gonna maybe potentially give you some proof. So, for instance, the number one identifiable cause of high blood pressure, which is the most common and prevalent chronic medical condition. You were talking about 4 chronic conditions encompassing about 80% of healthcare consumption. When you put all the chronic medical conditions into one bucket, and if I miss any, forgive me, high blood pressure, diabetes, stroke, congestive heart failure, coronary artery disease, cardiac arrhythmias, mood disorders, sexual dysfunction, memory loss, obesity, when you put them all into one bucket, cancer, every single one of these conditions has a first-degree relationship with sleep and sleep health. And most of us don't know that. So hypertension, high blood pressure is the number one is the number one chronic medical condition in this country. The number one identifiable cause of hypertension or high blood pressure is sleep apnea. Now, when we were in medical school, we were taught that 90 to 95% of high blood pressure is essential hypertension, which is a really fancy way of saying we don't really know why people have high blood pressure. It runs in families. If your family members have high blood pressure, you should get yourself checked because you probably have a higher risk. What we've learned in the last couple of decades in particular, the Joint National Committee on Hypertension, which is a group of really, really nerdy doctors who do nothing but focus on data analysis and or data analytics related to high blood pressure, who study it in detail, who study at the cellular level, the molecular level. The number one identifiable cause of high blood pressure is obstructive sleep apnea. We've just learned in the last couple of weeks in a study that was just presented in San Antonio that at least a third of Americans, at least a third, have sleep apnea. My mentors, including Dr. Christian Guilleminault, who's the founder of the field, co-founder of the field of sleep medicine, who coined the phrase sleep apnea, and if you listen to him talk, you would think I'm very mild, because what he says when he talks, and he's a walking textbook, really, what he says is that the majority of the human population has some form of sleep-disordered breathing or the other. Whether it's evolutionary, whether there's another reason for it, maybe I'm not qualified to comment on. Whether snoring was meant to ward off predators back in the day, I'm not qualified to comment on. What I can tell you is this, that in my journey, what I realized was that I could make a very, very potentially powerful impact on the practice of healthcare if I were able to really immerse myself in the understanding and potentially then the therapeutic benefits of solving for sleep. In my own personal journey, I became increasingly passionate about well-being because I just told you that you solve for sleep and you solve for health and wellness. The way I like to define well-being and if you see it differently, forgive me again, but this is just my perspective, is that there are really 4 pillars of wellness or well-being. Diet, what we consume; exercise, how we expend; sleep, how we recover; and then mental health, or how we feel. And when you connect those 4, there's really hardly anything, if there is anything, that's outside of the conglomerate of those 4 buckets or pillars of well-being. The thing about it is, for so long, we've tried to focus on healthy behaviors, changing lifestyle, employers, employees. We just learned about a month and a half ago that the cumulative return on investment, ROI, for health and wellness programs in the employer setting is 0. And what do we think is the reason for that? A lot of money, hundreds of billions of dollars are poured into understanding and trying to implement a successful health and wellness model. My father-in-law was an engineer at Boeing, electrical engineer at Boeing for many years, and I remember him telling me about 12, 15 years ago that Boeing encouraged its employees to use its on-campus exercise facility. In fact, they incentivized their employees to do that. Why? Why would you incentivize an otherwise already highly paid individual to use the gym, to carve out time from paid workday to go and use the gym? So we've had this focus on diet and exercise, changing behaviors, expanding literacy, which has its own individual worth. But at the end of the day, changing behaviors specific to diet and exercise is incredibly difficult. If it were that easy, why are we spending so much and getting nothing essentially net in return? Hey, Chris. So what I've learned and what we've learned and what we're now implementing in our newest relationship with the NBA, and by the way, the NBA, the National Basketball Association, probably some of the fittest people in the world, right? You look at them aesthetically, they look fit, and you look at their lifestyle, and some of these guys, they take it to a different level when we talk about diet exercise. But why would the NBA want to engage with a company out of southeastern Virginia to work on well-being? Because when we reorient the axis, when we look at what really works, the other thing about those first 3 pillars, diet, exercise, and sleep, is I like to simplify things because I'm not really that smart. So if you keep it simple and if you keep it straightforward, it's a lot easier to be able to understand and adopt and then potentially influence your behaviors. Break it down into quantity, timing, and quality. Whether it's what you consume, whether it's what you expend, or whether it's how you recover. Now, sleep is something that we can't get around. You fool yourself when you're younger and tell yourself that you don't need a whole lot of sleep because you're seemingly immortal, indomitable, right? But then as you get older, you really can't fight fate, right? And each of us is confronted at some point in time with his own mortality or her own mortality. And what happens with sleep, because it's a reversible state of unconsciousness, is that we're not aware of what's really taking place. So number 1, quantity. Most of us, if not almost all of us, require at least 8 hours of sleep as adults. Some of us may require more, very few of us may require less. And as we get older, beyond the age of 55, 60, we may not require 8 hours, maybe 7.5, but it really doesn't go below 7.5 to 7.25. So quantity. Timing. We're built to sleep when it's not light outside, right? So we have this 24-hour circadian rhythm. We have this cue. The most powerful cue for us to be awake and alert is sunlight, right? So if we fight that day-night cycle or rhythm, we run into problems. So you can sleep for 8 hours, but if you're sleeping, for instance, after working 3rd shift, if you're sleeping from 8 a.m. to 4 p.m., it's still not ideal or optimal, and it has its own host of complications. By the way, shift workers, 3rd shift worker, night shift workers, have a 3 to 7 time increased risk of heart disease, diabetes, obesity, depression, suicide, and premature death on average by 8.5 years if you control for everything else. So quantity, timing, and then quality. So you can sleep for 8 hours, you can sleep from 10 p.m. to 6 a.m., you can sleep on a nightly basis, but if your sleep is interrupted, if you're not getting deep, restful, healthy sleep, and you're not achieving the stages of sleep that some of you may have heard of, like REM sleep, which, by the way, REM is responsible for consolidation and processing of new memories. And we've just learned in the last few years that we think now that sleep deprivation is the trigger for people to develop the pathological amyloid plaques and neurofibrillary tangles that we call Alzheimer's type dementia. So maybe most of us don't know this. Unfortunately, too many neurologists don't know this. But instead of just popping pills or prescribing medications, if we take a step back and look for the root cause, I'm not saying that sleep disorders cause Alzheimer's type dementia or Alzheimer's disease. What I'm saying is that sleep deprivation, namely sleep apnea, triggers the formation of those plaques and tangles, which then become on autopsy the confirmation that somebody suffered from Alzheimer's disease. So if you solve for sleep, and everybody has a varying threshold of genetic susceptibility to a condition like Alzheimer's disease, like you do to hypertension, like you do to diabetes, and just about every other chronic condition. But if you solve for sleep, then maybe you can significantly raise your threshold, so that if instead of developing Alzheimer's disease at 55, you can prolong or change the slope of the curve, so maybe you don't develop it until you're 75. So we're now starting to look at these things from an evidence-based perspective, from a meta-analysis perspective. But when we look at the pillars of wellness or well-being, if we solve for sleep, which we have to do anyway, and there's no way to escape that, as much as we might tell ourselves otherwise earlier in life, we solve for sleep, and then it changes the way we approach, even biologically, diet, exercise, mental health. And I'll give you a quick example, and then I don't want to overdo my time. But most people who struggle with difficulty losing weight or obesity don't wake up in the morning and say, today I'm going to eat Kentucky Fried Chicken, Taco Bell, and McDonald's. Today I'm going to have French fries, fried food, and lots of carbs. But let me just take you a little bit behind the scenes here. So the hormones that are responsible for curbing appetite cravings or appetite stimulation, the hormones that are responsible for curbing carbohydrate and fat cravings, the hormones that are responsible for secretion of insulin and glucose, cortisol increases, or the pulse of cortisol in the morning is what is the primary driver for the secretion of glucose in the daytime. The hormones that are responsible for metabolizing fat, these hormones originate in the brain. I was telling you earlier about my journey and how the brain is the command center. And so if your sleep is fragmented, if it's distorted, if it's incomplete, you distort the secretion of these hormones, and therefore you become abnormally hungry, you crave the wrong kinds of foods. When faced with all things being equal, assume that leafy greens cost the same as, assume that Whole Foods cost the same as Taco Bell. When you're faced with healthy choices versus unhealthy choices, there's this unconscious factor that you can't or don't know why you can't control for, but you want the starch-rich, fried, fat-rich foods. And it's a vicious cycle. And there's a hormone of satiety, leptin, that tells us mechanically when we're full. And in people who are not sleep deprived, normal people, for instance, or let's just say healthy people who have solved for sleep, if you will, leptin is released and we become aware psychologically that we're mechanically full within 3 to 5 minutes. When you're sleep deprived, there can be up to a 30-minute delay in the release of that hormone. So imagine now, half an hour after you're mechanically full in a distensible, expandable organ, you realize, oh, I'm full, I should stop eating right now. And it starts a vicious cycle because it starts as this big, and then it becomes this big, and then it becomes this big, and then it becomes this big. And so now what's the primary surgical treatment for medically complicated or morbid obesity? Gastric bypass, shrinking the stomach. What are we doing? So if we understand that, and so when you solve for sleep, you can restore the normal secretion of these hormones, and therefore stop eating earlier when you're actually aware that you're full, not crave as much the unhealthy, starch-rich, fat-rich foods that are now implicated in the conditions like diabetes and obesity and so on, and live a healthier lifestyle. The same with exercise, the same with mental health. But I'll leave that for another day, and I'll stop there, and if anybody has any questions, we can talk about it. Thanks.
Yeah, thank you very much, Dimi. You know, it was fascinating learning about what Dimi does and how we can take that information and put it onto the platform. June is the monthly challenge that we have on our platform. Every month we have a different challenge. It's sleep health this month. And when Dimi saw the platform, he got very excited about the impact that he could have by imparting some of that information that he talked about. I would love to have a TED Talk type video of Dimi on the platform to educate people on the importance of sleep health, because he has personal stories where he's reversed cardiovascular issues by getting someone involved with a CPAP machine and reversing sleep apnea.
I haven't reversed anything.
Yeah, but you've improved.
God has reversed it. I have just been the instrument. But it's amazing, on that note, how many people have come with a when I was seeing patients, how many people came with a diagnosis of Alzheimer's disease? Now you imagine a patient and his or her caregiver or spouse, and they've been given a diagnosis, they've been given 1 or 2 prescription medications, they've been told, they've been given counseling, they go to now support groups, and you see this person and no one's ever asked questions about sleep and sleep health, and this person has a high degree of probability for sleep apnea. You find and solve for sleep, and now all of a sudden, you take them off their medications, you restore their quality of life, they lose weight, they feel better, you make it less likely they're going to have a seizure if they have a comorbid seizure disorder. And now the same thing, imagine the same thing with blood pressure, the same thing with diabetes, the same thing with obesity. We did some local, Jeff, you may have seen these, but we did some local ABC News stories on people. There was I'm going to tell one story real quick in 30 seconds because I'm very passionate about sleep, but I'm also very passionate about well-being, and I'm really annoyed about our knee-jerk reaction to how we solve healthcare problems by prescribing pills and saying, here, there's a quick fix. There's no quick fix for anything. Forgive me, I'm not being overly philosophical, but if it takes a long time to get to where you are, you can't just take a pill and solve it. And we live in a culture in which there's so much of an emphasis on instant gratification. We want everything at our fingertips. And so we think, oh, that's all right. There's a pill for that. There's a shake for that, right? Can't stay awake, there's a pill for that, ironically. Can't go to sleep, there are pills for that. Can't get it up, pill for that. Stays up too long, pill for that. Right? Don't have an appetite, shake for that. Too much of an appetite, bariatric surgery for that, right? So, it's just one quick story. I had a patient 10 years ago, and I could say her name because we ended up doing a news story on her, but Toka Nodal, TRICARE active duty beneficiary who was diagnosed with sleep apnea, who looked just like you and me, by the way. I practice what I preach. I sleep 8 hours a night, sometimes 8.5. I wear a CPAP. I'm 6 feet, 160 pounds. I run 10 to 14 miles a day. I told you I'm essentially almost vegan, but I wear a CPAP because I believe the majority of us have sleep-disordered breathing. So she comes, she's otherwise fit, but she's tired. Do her sleep study, she has sleep apnea, start her on CPAP because that's what she wants. She does great. She comes to me at one of her follow-up visits and says, can kids have sleep apnea? I said, yeah, you bet they can. I said, why do you ask that? She said, because I feel like my daughter may have it after everything I've heard from you. And by the way, like 90% of my visits with my patients at some point in time were more like educational as opposed to, hey, let me listen to your heart and lungs and so on and so forth. So I said, the difference is that kids fight sleepiness differently than we do. As adults, and there are differences between men and women, but as adults, we become drowsy, we doze off at a red light, we fall asleep on the couch, we have headaches. I said, kids, the most important early sign of sleep apnea in a child, by the way, Pearl, for anybody who cares, is mouth breathing. We're not built to breathe through our mouths. We're built to breathe through our nasal passages. So any child who's a mouth breather, always think there's an obstruction in the nasopharynx and nasal upper airway. So she says, you know, my daughter has been diagnosed with ADHD. She's on 3 medications right now. I feel like, you know, she's 8 years old. I feel like she might be drugged, like too much, and I feel like this isn't my kid anymore. So fast forward, I said, yeah, you know, does she mouth breathe? Does she look like you, Toka? Yeah, she has my chin, everything, like craniofacial structure, which is the primary risk factor for sleep apnea. So her child comes, has sleep apnea, gets tonsils and adenoids removed. I start her on intranasal steroid sprays. She's better, do a repeat sleep study. She still has some residual sleep apnea. And her daughter says, can I wear the machine my mom wears? And I'm like, you're 8 years old. Are you sure you want to wear this thing? And she goes, yeah, I want to try it. All right, so we start her on CPAP. So a pediatric mask and everything. So 6 months later, and this is not an exaggeration, and this is not a one-of-its-kind case. This is a rule. 6 months later, her mom is in tears. She's off all 3 of her ADHD medications, straight A student, no conduct issues in school. She says, Dr. Barot, you have given me my daughter back. Now imagine how many people screen for sleep problems when they're inattentive, distractible, impulsive, and sometimes hyperactive. What do we do in school? We send them to the counselor, we go through the ADHD form, and refer them to a psychologist or a psychiatrist for prescriptions. So I don't want to overemphasize this point. I'm not saying that we're doing everything wrong. Please, I'm not capable, I'm not qualified, and I don't think it's right. What I'm saying is that if we don't ask the questions, we'll never be able to potentially find the answers.
Right. Thank you very much, Dimi. And we're going to continue on with Dean Bonnie Van Loonen, who's really the person that's been responsible for all of us being here today, the College of Health Sciences. They do amazing stuff, innovation area, but I'm going to turn it over to Bonnie to share her thoughts on what we're going to be doing together to build a healthier Hampton Roads.
So I think everyone stole my thunder. You all brought forward many facts today that I only found out because I started reading more on health literacy. I grew up on a dairy farm in Vermont. We do have better cheese than Wisconsin. You knew that coming in, I think, you know. And what Tom said is true. Parents will do anything their kids ask. So my dad was a smoker for a very long time. They came from the Netherlands and came here. And when he was 40, there's 7 of us, we bet him that he couldn't stop smoking in another dad. And we would unload all the hay all summer and not complain. He took the bet. He won the bet. And he stopped smoking since then. But every condition that you guys talk about, he has. And he's 78. But he has all of those conditions. It's really interesting. My background is in athletic training and sports medicine. So our patients are pretty healthy already. But you'd be amazed at the things that we're managing. I think what the College of Health Sciences had done for me is to open my mind. We prepare health professionals, some healthcare providers. I bet many of you employ them as well. And I'm not sure we're doing the best job that we can. We have very different schools. You might think of the School of Nursing comes to mind, and that's an automatic, right? They definitely provide everything that is needed by a patient. But I wonder, because we're very fast, some of the data states that 9 out of 10 people, when they leave the physician's offices or offices of a healthcare provider, can't remember anything they said. That's a little bit, that's high, right? We're talking about 80%. Now I'm going to 90%. And I just, you know, my daughter was in the situation the other day, and she went, and I said, so what happened? Well, and you've all been there where your kids come back, or your parents come back, or your wife or husband or a spouse or significant other comes back, and they can't remember what was said. And so what do? They call me. They call you. if you're a healthcare provider and they say, I've got this question. And it would be much easier for me to provide them with the information some other way than having them call me all the time. I do know this fact, and I'm kind of making it up, but 100% of Old Dominion University students can walk and look at their phone at the same time. So if you walk across campus, and I experiment constantly. I have a good evidence-based background. I experiment all the time. I'm walking across campus, and I'm trying to make eye contact with a student. Heaven forbid. And I'm just trying to say good morning, or good afternoon, or how you doing, and they're multitasking, which I really enjoy. So I think here at Old Dominion, we actually have a captive audience. In our college, we have about 2,500 students, but we have almost 26,000 students. Right, Bob? That come through student health or part of student health here at Old Dominion. We have a captive audience, which many of you have your employees or those you work with, but we have a captive audience. They have to put their phones away for a little while, but they're always on them, so why don't we use them? So when I was introduced to this platform, we showed it to our administrative team and kind of went through it, and the nurses actually were so excited. They said, we've been trying to make a platform like this for a while, and it just wasn't working. This one has it all. What else does it need, Tom asked. We need more in mental health. We need more ways for students to easily find where they can go. Now you see walking across our campus, there are flyers posted on almost every place you can find about what a student can do if they're in a mental health crisis. Who can they call? What's the next step? And that's awesome. But they're not always going to be walking by those flyers. So I think we need a way and a mechanism to do that. The other couple of cool things, Old Dominion is really cool. It's my 20th year, but my first year in this position. We have grown so much because of all of you, because you support us left and right. We started that Institute for Coastal Adaptation and Resilience. It has a health dimensions arm. And we're also exploring this Center for Telehealth, fits right in with this. Access, right, for the patients and what they can come in contact with. Then we potentially could also explore a Center for Health Literacy, where we, the experts supposedly, right, but we can conduct the research, we can do the education, especially in a College of Health Sciences, but I think more so for the whole campus. There's got to be a better way to educate our whole campus. If you asked your son or daughter as they went to the physician's or healthcare provider's office, what's the copay? And they're like, well, I don't know. That's something I pay when I go there, but just give me the insurance card, Mom. I'll be all set. That's the extent, I can tell you, of a 20-year-old's knowledge who does not have that background and training. And that's very minimal. And in that case scenario, that's my daughter. And she grows up in an educated household. She's well provided for. But when I was growing up, we didn't go by ourselves. We never went to the physician. We didn't have health care. We were in a rural 300-person town, more cows than people. So that's a whole different scenario. We want to be able to reach those individuals as well. So I think my role here is just to make sure we can bring all of you together. Old Dominion's not going anywhere. We are the ones who can launch some changes. And I think all of that I've heard the panel say today, gosh, I need more sleep. Oh, you know, I do. Because I know it affects all those things, because you know how you react when you don't have enough rest. And the things that you're doing with the girls, I think here, I got to go watch the pitches later, right? and Les with his company, it's perfect. He was looking for an answer, a change. And this was, he said, I'm willing to try it. And I think that's where we are as Old Dominion as well. We're very entrepreneurial and we'll try things. So I'm speaking to you from the person who, I'm a first-generation college student. And so if I can learn about health literacy and how that affects my health over time, then everyone can. Because it's a lot easier than milking cows, I can tell you that much.
Thank you, Bonnie, very much. Yeah. I'd like to thank all of the panelists. We could spend a lot more time with them, but from Les as an employer perspective and a person that's making a difference in Hampton Roads, Angela's work in mental health and really helping with those social determinants of health. Dr. Dimi Barot on sleep health. It's fascinating, and I'm sure we're going to be sharing some more things on that area within the platform. And Bonnie from the health literacy perspective in the College of Health Science, as you launch public health, health literacy will be a key part of that. But again, let's give everyone a big round of applause. We're going to shift into our kind of closing comments, and we appreciate everyone. If you can hang with us for another 10 minutes or so, I'm going to ask if Jim Spoor and Nancy and Scott will join me in some closing comments. And again, thank you very much to all of you. I appreciate that. Thanks, Bonnie. In our closing comments, I want to just share a few things. And again, we're going to all be here to answer any questions. At the beginning, Nancy talked about the cards that everyone has. We'd like everyone to actually put some thought into that. And if you leave here today and have ideas, give us ideas of people that you think should be involved, organizations, individuals. If you want to get on the platform, we'd love to have all of you on our platform. There's a lot of people that are on the platform. Incidentally, the #1 area of interest by ODU students on the pilot program we're doing is sleep health. And so if you guys want to get on the platform and experience it, many of you are already on that, let us know. Just check on there that you want to get an invitation to be on that platform, and Brooke will make sure you're on there probably later today. I'm going to go ahead and just really quickly make a couple comments, and then we're going to have a few closing comments from everyone. But Healthier Hampton Roads is the initiative that we're doing here, but a consumer-facing site is going to be the URL Rewards for Healthy Living. So we own rewardsforhealthyliving.com, .org, .net, .info, and this is our branded what's in it for the community. And people will go to get rewards, and we're going to have really powerful rewards, monetary rewards and gift cards in other areas. And hopefully we'll have some significant ones that potentially could even be a car. Someone that is a Medicaid mom with 3 kids and is challenged with health literacy, she may go on there if she can win a $5,000 reward next month, or if she could win a car at the end of the year. Things that are going to really make a difference and get them excited about that. But what can you do on there? I'm not going to spend all the time, but there's a lot of information. And all of those chronic conditions that Dimi just listed off are all on the EdLogics platform, through game-based learning, through videos, through other areas. And this is what you can do on the platform. And if you get on there, you'll be able to experience yourself. But there's points and rewards and virtual pharmacists. You get a GPA, you can get challenges. I'll let everyone take a quick picture of that, but we'll share this with more. But you can either come in here and get access to the Boys and Girls Club through a flyer that you get from your kid, or through the YMCA when you check in. We're going to have distribution channels. And we're not trying to boil the ocean. We're trying to get the platform out so people start using it. We collect information. We have 1,500 people. We get 2,500 people. We have 10,000 people. We think we can get hundreds of thousands of people on this platform giving us information, and then use it in an organized way so all the different communities are going after opioid education over the next 2 months. And so we can challenge and we can bring people together. And Jim Spoor, I'm sure, would like to have a couple comments on that, because that's really what their mission is at reInvent, is realign people and get everyone aligned. Maybe this initiative could be one of those things that brings everyone together. I'm not going to spend another minute on this, other than this was the vision at the beginning that Tommy talked about, and it's going to be continuing to be our vision. And then I just added a couple things here, and then I'm going to open it up for a Q&A and other speakers giving a few closing comments. But support of local government, universities, and community organizations. Again, think through people, organizations that can be part of this in a grassroots campaign, because everyone here can go out and kind of talk to other people, and this will happen. Ultimately, it will be on the Channel 6 Evening News. Don't forget, you can improve the health and wellness of you and your family by going to rewardsforhealthyliving.com. When you walk through the airport, the billboards that are out there, we'll have social media, we'll have ways, but we're starting with grassroots. We're starting with people coming to bring this information out to their friends, their colleagues, and to individuals that can make a difference. And then adequate funding to support the program deliverables, incentives, and long-term infrastructure investments. We can't do it without philanthropic support. We're investing into this as an organization, ODU, the Brock Institute, EVMS, Sentara Healthcare, other organizations, but we're looking for individuals to help us in accomplishing this, and it takes funding to do that. So think about ways, and if you're individually able to do that and help, that's something that we'd like to talk about. I'd like to kind of have Jim and Scott and Nancy have any closing comments. And also, if you have questions, please raise your hand, feel free, and don't think you're interrupting. But Jim?
Well, hey, just very briefly, as I said earlier, we're all about partnerships. I've been amazed at the power of partnership, and it's so fascinating to think about how this region works and all its complexity and all the people that are trying out to do very good things. I really think that this is an important initiative. I like what Bonnie was talking about in terms of the Center for Health Literacy. I think that can be maybe the start that we can add to and grow from. So we would love to be a part of it, and thank you all for being here.
Awesome, thank you. Scott, would you like to have a few words?
Well, a few years ago, we did a forum called Why Health is Nobody's Business. And I think this can be the opportunity for us here to make health our business and make it sustainable, scalable, and that's very exciting. I look forward to your questions.
Great. And then Nancy, closing comments, and we're going to give you the last word in a few minutes.
Yeah, so just a couple closing comments. Again, I think Bonnie said it well. ODU certainly wants to be a major participant in this Healthy Hampton Roads initiative. We certainly have a lot of resources today, but the concept of a center for health literacy excellence would be really pretty phenomenal, that could really branch out way beyond the region and on beyond. So we do want to thank everybody, and I know we left a very, very short period of time for questions, but if there are any questions in the audience, we can take them for any of us before we adjourn about the content, about the idea of the movement, any questions that any of you may have. So any takers? Yes.
Are there any conversations with managed care organizations incorporating health literacy into their physician incentive programs?
So the question is, are there any organizations in the managed care setting that we can introduce health literacy?
Right, into their physician incentive programs.
So we're in the early stages of doing that. I don't know if Jordan Asher left. Jordan was here from Jordan's here. We're in discussions. We got a meeting coming up and talking about Sentara. We have other physician groups. Chris Dowd is here as a concierge physician and in the area of wellness for employers. Jeff is here. Jeff, I think, was here from Bayside, I believe, and Bayville. Yeah. And so we're in early discussions on that with managed care organizations, with physician groups, because a smarter patient is going to be a more productive one. And as the reimbursement starts shifting to outcomes, then the physicians are going to have an incentive to have their patients engage in their care, because the better outcomes, the more money they'll get reimbursed. So in the past, they didn't really like direct-to-consumer advertising. And if it's very evidence-based and there's information and we can educate consumers to be better patients. We're even looking at the EVMS, the standardized patient, where they train physicians on how to be better physicians. And I asked the question during one of the tours, have you ever thought of videotaping these 81 actors that are here in Hampton Roads that act as if they're a diabetic patient, to get that physician to ask them the right questions, and then they train with residencies and physicians. We asked the question, have you ever thought about using that concept to make better patients, better historian, better diabetic patients? So we're looking at EVMS and ODU. Carolyn Rutledge and her team are involved in the scripting. So we'd love to take EVMS, ODU, to build a standardized patient so that physicians can actually share that. Here's how you become a better asthma patient. Here's how you become a better diabetic. So everyone wins in that. The Tidewater Free Clinic with Chet Hart over in Suffolk, if we can take this platform and sit Mary Jane down after she's been diagnosed with diabetes and have her watch a video, she may not have internet access, but she can actually learn from that little computer screen in the education room at the free clinic. So we're looking at ways that we can incentivize individuals and physicians and managed care organizations to get consumers and patients more engaged in their care. Great question.
Thank you.
Yeah.
I actually have another question.
Sure.
You had mentioned earlier the gaming, and 80% of the patients were able to improve their health, and the other 20 were unable. What were the reasons they were unable to improve their health? What were the challenges that they were facing?
Well, the stats that we have is that we have 81% of the people say they will change their behavior, and we haven't really measured to improve their health. You're talking about the ball slide, or? Yeah, that's really population health in general, not on the platform itself. But we're starting to look at the data where we can look at changes in blood pressure or diabetes control. And so we're still early on looking at that data. So that 80% was really across the board for the population as a whole, not on the platform. But we're going to be getting more information. We have self-reported data, but we're going to be able to look and work with the United Way and start saying, how do we change the dashboard? How can we change those red, yellow, and green zones that Jim Spoor put up? But good question, but that's kind of where we're going. Question here.
Hello, my name is James, and I appreciate the opportunity to be here. I'm actually an alumnus of the College of Health Sciences, and I'm very familiar with Bonnie and with some of the other folks affiliated with the College of Health Sciences. I work in applied public health at the federal level, but I want to emphasize just a couple points. I really appreciate this forum. It's really been very helpful. One is the importance of the partnerships in the Hampton Roads area. I think one of the longstanding challenges of the Hampton Roads area is the challenge of having all the cities talking to each other. And so, Mr. Spoor, I appreciate you being here, being in your capacity with the city of Virginia Beach in the past years, but the importance of all the cities in the region talking to each other, and even if we bring in the term Tidewater, or whatever are the references to the region, making sure that's a continued effort. But also I'd like to emphasize the importance of environmental health, the value of mental health first aid. There is content for both the adult audience and the adolescent audience. I've been through the training, and we're implementing that in my own workplace for some staff training on mental health first aid. Also the importance of the digital platform, so like TED Talks or TED Med type formats, and just the overall value of these connections. So I just want to really emphasize those things, and I appreciate the opportunity.
That's awesome. Yeah, we really appreciate that comment. That's really at the crux of it. What we're trying to do here, the outcome we're looking for, is everyone working together and have everyone aligned. And that's been the challenge of Hampton Roads. Everyone has their own pockets, their silos. Tommy talked about avoiding those silos. And I think we can do that with a connected platform, because no one doesn't want to be involved in health literacy and really changing behaviors for the good of the health and the prosperity of the economic region. But we really appreciate it. Would anyone like to comment on James's comments? Great. Any other questions, comments? Elizabeth?
Hello, I'm Elizabeth Locke, faculty member here in the College of Health Sciences and a physical therapist. We've talked at great length about the need to provide health literacy avenues to populations in Hampton Roads, but there's yet one untapped, and that is the disabled population. Are there any strategies that are on the table currently to address the needs of persons with disabilities and the families that live with them?
Yeah, it's on our roadmap, and we want to make sure that we get the platform out and start actually taking the disability area, taking the low-income neighborhoods, looking at the various organizations. Even Tommy mentioned the prisons. So there's interest in putting the EdLogics platform in prison systems. So those various pockets are where we're going to start. Over the long haul, we want to hit all of them and bringing partners in. We're getting it out there now, and then we're going to start identifying. But it's people like you that are going to tell us where we need to spend our time and our energy. So that's really at the key is get it out there, collect information, and then start identifying those populations that really could use our help. Other comments? These are great questions and comments. Kimberly?
Yes. Hi, how are you?
Yes.
Kimberly Adams-Tufts from Health Sciences. Core question, thank you for the opportunity. This is a wonderful opportunity to be with folks in like-minded and to also think about how we can leverage the various resources we have across Hampton Roads and to come together. The coalescing of our resources has been an issue, but I'm thinking about the individual at this point. Are there any fees, consumer-directed fees, and how is the platform supported? And what's the level of access folks can have, and how might they go about that?
So this is a free platform. We charge employers and universities. Sometimes they're subsidized by an Aetna, a Cigna, United Healthcare. Oftentimes the employer gets our platform with subsidized fees from a partner of theirs. What we're doing is we're putting it out there on our own dime, making it available. But for the longer term, we need to have philanthropic money, we need corporate donors, we need other individuals. So we're going to be raising money to support this initiative, including incentives. Because without incentives, it's difficult to get people on board. But we're looking at a couple $1 million a year just for incentives. And for the infrastructure, we want to hire program managers. This is done on EdLogics staff, on the Old Dominion University staff. And so all of this is an unfunded event. And there's been people that want to fund that, but we want to kind of get it out there and make it available. Everyone in Hampton Roads goes to rewardsforhealthyliving.com and they can put it out there and get free access to that.
So have you thought about it? I don't know if it's still, you can still utilize it,
But local partners initiatives through Robert Wood Johnson and also their Healthy Communities initiative.
So that's the longer range. Those are big grants. HUD just gave Norfolk and Newport News, I think, $30 million in housing. Housing, people with a house over their roof over their head are healthier. So the link between housing and health literacy is identified in those HUD grants. There's no one that can do health literacy cost effectively unless they have a digital platform. It's too labor intensive. We wouldn't be here today if we didn't have the infrastructure to make that happen. So that's really where we want to go. Robert Woods Johnson, there's a gazillion dollars available to build healthy communities, but very few opportunities to really put that in action. And you have to be able to measure the impact. So we'll be getting grants, but it starts with philanthropy, with foundation support, with individuals that have a commitment. If you're donating money for a tax advantage or whatever, we want to be able to bring that into ODU, bring it into the Global Action Platform. Scott, that's what he does for a living. That's why we set up a 501c3, so we can fund this both here in Hampton Roads and in Virginia. And the employers are going to still implement this because the employers get information and they can drive their own issues and needs. But in Hampton Roads, it's going to be a free service and it's going to be announced and with social media. But we're excited about doing that. And think about what we would learn from 100,000, 200,000 people in Hampton Roads and Nashville on the platform, the data that we would be getting, data that's not available anywhere in the world. Other comments on that or questions? Scott, do you want to talk about any foundation type?
I think you covered it.
Good. So we're wrapping up. Any last minute comments or questions? We hope that you enjoyed your time here. You learned about Healthier Hampton Roads, understood a little bit more about health literacy, learned about sleep health and mental health, and saw what employers are doing in the local community. Again, I want to thank Les for being the first one that really started this. Everyone here has a role. It's a grassroots campaign. Please give us your comments on the cards. If you don't leave them with us, there may be issues that we're going to deal. But again, I'm really excited. I want to thank Ray Shively and J.R. Locke and the rest of our team for helping to make this possible. But more importantly, I want to thank each and every one of you for staying with us and learning more about this. And we hope to partner with all of you and spread the word. We're going to be doing great things in Hampton Roads, put us on the map on an international basis. So thanks again. Appreciate ODU making this happen. Jim, Scott, and Nancy, and Bonnie. I appreciate it. And Tommy Thompson, we're so excited that you came here to see the battleship again and spend time with us today. Thank you so much. You guys have a great day. Appreciate it.